Foundations for core strength. Start by lying on your back with your knees bent. Place your hands between those two bony landmarks on the front side of your pelvis. Keep your hands here as you learn to do this exercise. On your inhale, notice how your belly expands and your fingers rise. On your exhale, you're going to engage the space where your hands are, below the navel, above the pubic bone, and you're trying to let your fingers sink down with that muscle. Inhale, you release, and then exhale, draw that space in, almost like you're trying to bring those bony landmarks together. This isn't a big dramatic movement. It's really subtle, and you're trying to engage the deepest core muscles here. Try it again. Inhale, fingers rise, and then exhale, draw that space in, back, and slightly up even. If that feels too complicated, just draw it in. And notice that I'm not tilting my pelvis or moving my back. Everything's stable, and I'm just working on engaging the TA. Let's move on to the low back now, the multifidi in particular. Place your fingertips along your low back. In standing, place your hands on your hips, walk your thumbs and fingertips to the center where your spinous processes are, all those bones. Walk your fingertips out a little bit from the center point. So lie on your low back with your knees bent, with your fingertips along those muscles. So find your breath here. And then what I want you to do, just close your eyes. And with your mind's eye, I want you to picture about 5 blocks stacked on top of each other. And these blocks are the vertebrae of your lumbar spine. So the vertebrae of your spine have muscles running alongside them, and there's plenty of muscles in the back. But the deepest of the muscle groups are pretty short, and they connect the blocks. And so whenever we activate these muscles, I want you to envision in your mind's eye the blocks just gently squeezing or compressing just slightly together. Almost as if you're holding a Big Mac and you have to squeeze the Big Mac just a little bit and compress it just a little bit before you bring it to your mouth. So can you, just with that picture in your head of compressing the Big Mac, can you activate those muscles along your spine with your exhale? So inhale, let it go. Exhale, think about compressing those blocks of the lumbar spine a little bit without any tilting of the pelvis and without an over-bracing action of that TA. This is a subtle movement and can take some time. So you can compare with your TA contraction. Do you notice any movement there at the lumbar spine or just muscle activation with that TA? You probably do. Most people are TA dominant. So let's see if we can connect with this muscle group on the back just by doing that mental imagery. And if that's very difficult, then I also like to cue the pelvic floor. So keep your hands there and we'll just notice what we notice with pelvic floor cueing. So here lying on your back, it'll be a little bit different for men versus women, of course, but let's focus on the front side of your pelvic floor. So where your urethra is, I want you to think about drawing a blueberry in just a little bit with your exhale. So inhale, release, and then exhale, think about the blueberry. What do you notice at the low back? Do you notice any activation there along the fingers? So spend some time here as you like, focusing on that blueberry outside of the urethral opening, and you're trying to draw it in a little bit with the exhale with no gripping of the glutes or anything. So do this along the pelvic floor. So for women, we'd move down towards the middle portion. So outside the vaginal opening, you're thinking about envisioning a golf ball or something. And then you're drawing the golf ball in just a little bit with your exhale, not doing a full Kegel or anything like that, with your glutes not clenching. And then you inhale, let it go. And then exhale, draw in. And then inhale, let it go. And what do you notice at the low back? Do you notice any more activation, really subtle activation at the low back? And then we move on towards the posterior side or the back side. So outside the anal opening, you're thinking, I don't know, marble or something like that, outside the anal opening. And then you're bringing the marble in just a little bit, no glutes clenching, and then inhale, release. So what do you notice about doing these different exercises? Which one is easiest for you to activate? Is it the TA? Is it the multifidi where your fingers are in your low back? Is it the pelvic floor? And then what's your weakest link? Where is it hard to connect? Each person is a little bit different, but most people tend to have more difficulty with the multifidi, like where my hands are in my low back, and then the pelvic floor. So our goal here is to get the core to sync well, synchronize well. And with chronic pain, sometimes it doesn't sync so well. But you can trust that over time with some practice, your nervous system will get this down and you don't have to consciously think about this all the time. We're just starting from a good solid foundation here. So your job here is to find which one are you dominant in, and then which ones might be on the weaker side or just hard to connect with. So for example, if you found the TA to be easier, and then the pelvic floor was easy-ish, and then the multifidi was hard, then let's try leading with the pelvic floor in your breath and seeing if we can find any movement of the multifidi or activation of the multifidi underneath the fingertips. So using your breath, with the inhale you release, exhale you do that pelvic floor activation, not clenching, not a full Kegel. Can you find any movement or activation at that low back multifidi area? And all you have to do, if this is super confusing, all you have to do is use that visual imagery, okay? So think blueberry. If you're targeting the pelvic floor, you can even think the Big Mac or the blocks stacked on top of each other and just slightly compressing with the muscles of the low back. Keep practicing this. And of course, if you're working with me, we're going to build this into your program for strengthening and functional movement.